phew, like we found a kinship placement for these kiddos. But then once they're in your home, there's really a now what? What are we going to do, and how do we support these kiddos? So I want to talk a little bit today about the now what. And one of the things I'm aware of, I don't know if you all are feeling this way, but even as a psychologist, I feel like we're getting like more advice than ever during this coronavirus thing. Like there's all kinds of people on the news and people emailing and all kinds of things about how to take care of ourselves. And sometimes we get kind of emotion or advice overload. And so I want to try to keep things simple enough that and just talk about some big ideas that I hope can be helpful for you as you're thinking about the kiddos that are in your care. So one of the basic things I wanted to introduce as a psychologist, a lot of the strategies or tricks that we use to help kids and families are based on an idea that's called cognitive behavioral therapy. And the cognitive part is about how we think, and then the behavior part is about what we do. And so I teach even little preschool kids about this idea of how our thoughts influence our feelings, and our feelings influence our behaviors. And I use the example with kids a lot. If I was in school and somebody came on the speaker and said, Dawn Huber, please come to the principal's office. If I think, man, I am in trouble, I may feel nervous, I might feel angry, I may feel like I'm not going to go, I may walk real slow. So thinking about being in trouble is going to create one kind of feeling and behavior. If I think like, oh, I'm probably getting an award, I bet they're calling me to the principal's office because I got a prize or something good happened to me, then I'm going to have good feelings, and I may walk there faster. I'm probably not going to avoid going, and I'm probably going to be in a better mood and have a better attitude when I get there. So the way that we think about things has a really big influence on our feelings and on our behaviors. And that's so important for us to understand as caregivers, just as much as we want kids to learn about managing their thoughts and their feelings and behaviors. So one of the things that you'll hear me emphasize as we talk today is that really anything that we want kids to learn, it's good for us too. And so all the time that you're caregiving, you are a role model, and you are a learner right alongside these kiddos in developing these skills for kind of taking care of our mental health, for managing our emotions, for learning new things and doing the best that we can do. And so I want to focus kind of on some big ideas about how you can start to think about what you're going to do, because the more helpful thoughts you have, the more successful what you do is going to be. So this next slide, I had a hashtag good enough. And I think that's something that's really important for all of us. I know I have to remind myself of it, that we're not shooting for perfection. We're all going to make mistakes. We're never going to, I don't think in parenting or caregiving, there is ever a perfect day. We may have some pretty good moments, but I don't know that we ever get to perfection, and really thinking about just doing a good enough job. And that's important, because if we are focused on not being able to make mistakes, being really critical of how we're doing, feeling like we can't do it, those are really unhelpful caregiving thoughts, and they get in the way of us doing the best that we can. So even just focusing on, I'm going to do good enough by these kids, is a really helpful way to think about how you're going to interact with them, how you're taking care of them, and taking on what is a really big challenge. Next big idea that I want to talk about is just how important it is for you to take care of yourself. And I have this diagram on here. If you fly on an airplane, they always give you the directions of how to use the oxygen mask. And part of the directions they always give you is place the oxygen mask on yourself first before helping small children or others who may need your assistance. And I think this is so important for foster care providers, for kinship providers, really just for any caregivers. You taking care of yourself is really critical if you're going to feel patient, if you're going to be able to think and problem solve when there are challenging situations, if you're going to feel persistent. And I don't know about you, but I was kind of raised with a way of thinking about caregiving, especially for moms, that you were really not supposed to take care of yourself. You were supposed to sacrifice your sleep. You weren't supposed to buy things for yourself. You were supposed to eat last. All the other things I can think of the messages that I got, that moms are really just supposed to give up everything. And the problem with that is that doesn't really make for very good caregiving. If you are a caregiver or mama or daddy, auntie or uncle, and you're not sleeping and you're not eating and you never do anything you enjoy and you don't have social support, boy, are you going to struggle if you have challenging kiddos in your home to deal with. And I think that especially moms and grandmas and aunties can feel like they're being selfish if they are taking care of themselves. So I always encourage caregivers that this is a gift you're giving the children in your care. When you take care of yourself, it is a gift that you are investing in yourself. You are fueling up yourself so that you can be patient, that you can think straight, and that you can be persistent in these really difficult situations. I think that this is even more important for if you're dealing with kiddos that may have experienced trauma or have other kinds of emotional problems, behavior problems, or developmental problems. Because one of the things that we know is for kids who are struggling with their own emotions and struggling with relationships, they may not do things that really fill up your bucket. You may not always get the I love yous or the hugs or the help that you wish that you would get. And that can make the work of caregiving even more exhausting because you're pouring out a lot into the buckets of these kiddos. You're drawing a lot from your bank account, and they may not always have the skills yet to give a lot back to you. So it's important that we take responsibility for taking care of ourselves as caregivers, and that we're not asking kids to fill us up emotionally or to take care of our needs. And I think that's especially important because a lot of times kids who are in out of home placements, they already have kind of mixed up ideas about how relationships work and about what their responsibility is as a child. And so I think it's a really powerful thing for kids to understand that they're not responsible for the feelings or the self-esteem of the adults who are taking care of them. That's our job as grown-ups, to take care of ourselves. And I think self-care is a really, really great opportunity to be a role model. I don't think we would ever tell a child who was struggling emotionally, behaviorally, or with their learning, I don't think we would tell them that it was okay to skip sleep, or that it was okay to skip meals, or that they didn't need to spend time with their friends. So when we take care of ourselves, we're really sending a message about valuing ourselves that is a really good role model. And we're also being an example to kids of practicing things that we want them to do in their own self-care. So please, and again, you're not going to be perfect. You're not always going to get your oxygen mask on first. You're going to do a good enough job is what you're going to shoot for, of getting your oxygen mask on and taking care of yourself. And so that's one big idea that I want you to walk away with today, is that importance of filling up your own bucket, getting your oxygen mask on, taking care of yourself, and how critical that is to being able to do a good enough job as a caregiver. Another big idea, I've got this picture up here, and you've probably seen ones like this in different commercials and things like that, where there's some cracked mud or a cracked sidewalk that just looks miserable, but there's some beautiful flowers growing up through the crack. And I always like this as an image of resilience. And that's one of the things that I want us all to think about, is that as human beings, we're really wired to be resilient. As a caregiver, you are built in with so much resilience, and the kids that we care for are really resilient. And I think it's so good and so important that we're talking more about trauma, how that affects kids, how we can help them. But I want to make sure that we don't write stories for children that are only trauma stories. I want us to help write them, write a resilient story and help them focus on their resilience. Um, there's lots of ways that we support resilience, but one of the best ways is through that idea that we already talked about in terms of self-care. And I know in struggling with this response to coronavirus, I hear from a lot of people, especially sometimes if we those of us that have had like lots of education, and we try to make everything really, really complicated, and we think coping skills should be something really fancy and complex. But the truth of the matter is, the basis of coping and resilience is really basic self-care. And it's things like sleeping and eating and getting some movement into your day, doing some things that are fun, paying attention to our emotions, having some social connection. And so as you're thinking about how to support the children in your care, sometimes they come to you with really complicated problems. And there can be really simple solutions that are very powerful in helping kids with complicated problems. So as you work to help them have a bedtime routine, and you put meals on the table for them, and they're in a safe home, all of those basic things are really, really powerful toward their resilience. And again, you have an opportunity to model all of this. When I was in graduate school, and I would get very stressed out and dealing with a lot of other things in life, I actually put a sign above my desk that said, "If you are feeling down, move your butt." And that was my reminder of how much movement and physical activity were important to how I was feeling and how I was thinking. And so I think about with kids, if you are in a stressed out moment, and you can say, "Hey, let's go for a walk for a minute. Let's step outside and take a deep breath." These are all opportunities that you have to be a role model. I encourage caregivers, you can put yourself in time out. You can say like, "Wow, I am really overwhelmed. I'm just going to have to take a time out for a minute and take a deep breath, or stretch, or walk, or dance to some music." So you don't have to be perfect. And in fact, because you're not perfect, it's what's going to make you a great role model for these kids, because you can use all of your struggles and all of your mistakes as a chance to practice the kinds of skills that we want kids to have. And in fact, you're gonna help kids more if you're willing to admit you're not perfect, because they can't ever live up to trying to be perfect anyway. So if you're right there with them, practicing these things and trying to do the best that you can, that's really, really helpful for kids to see. The next big idea I want to talk about, this slide has a picture, and this is an old one, of Judge Judy. I don't know if any of you ever saw that TV show of this very sassy, all in charge, no nonsense judge. I would not have liked to ever be in her courtroom for anything. She's not my style of problem solving. But I put this up here because another really important idea, both when you're thinking about yourself and how you're doing as a caregiver, or about the kids in your care, is don't judge. So when we're judging and we're saying, "That's good, that's bad, that's a failure, this is no good," that never helps anybody to do their best thinking or to manage their emotions. And this takes a lot of work, because boy, from the time we're little, are we ever trained to be judgmental? So it takes a lot of practice to work on not judging. And I'll give you some examples. most of the kids I work with will say that it is not okay to feel mad because they have been taught that being mad is bad. And the truth is, being mad is really, it's important. It's an emotion that's wired into our brain because it tells us that something is wrong, something is off that we need to do. And it is absolutely okay to feel mad. Now, when you're mad, it is not okay to hit or break things or throw things. And those are behaviors that aren't okay. But we tend to talk to kids about their feelings as being good or bad. And that kind of judgment and putting labels on can make it really confusing for kids and not send the message that we want to. I try to use the words helpful and not helpful whenever, even when I'm talking about a behavior. Is that going to be helpful or is that not helpful? Or talk about, are things okay or not okay? But try to stay away from just categorizing as good or bad. I also think not judging is important because, especially for these kiddos in your care, we want to think about what their behaviors are telling us, that behaviors are communication. And so many families that I talk with have kind of the same thinking that I was raised with, that if you did a bad behavior, kind of like that was a character problem. Sometimes people even talk about it as a moral problem or it's sinful, and then that there needs to be a punishment for that bad behavior. The problem with just sticking to that kind of thinking is it doesn't tell us how to help kids learn how to do better. It doesn't teach them any thinking skills. It doesn't help them do better the next time. And we may really end up just having people feel ashamed or feel guilty in a way that isn't helpful. So thinking about, that when we see even a behavior that's not helpful or not appropriate, that is that child's best effort to get their needs met. That's that child's best effort to communicate with us. And especially for kids who have maybe been in abusive situations, neglectful situations, really inconsistent situations, they may have developed some survival skills that really helped them be resilient. But then once they're in your care, they may need to learn some other skills. And I'll give you an example. I saw a little boy who's in a kinship foster placement, and he was described as being incredibly aggressive and being really kind of antisocial, not wanting to interact with people. Well, we found out that when he had been in someone else's care, in parents' care, he had been in some really, really unsafe situations where the way he got these unsafe adults to leave him alone was by, really acting out, by hitting and kicking and screaming and avoiding other people. So, really, I'm happy that he developed these behaviors that kept him safe. I think a lot of people left him alone when he was in an unsafe situation. But now that he's in a safe place, he needs help to learn some other skills, some other behaviors. But when he's showing this hitting and kicking, it's his best attempt to keep himself safe. And so I think trying to stay away from judgment that you're a good kid or you're a bad kid, and more thinking about behavior as communication, behavior as a way that we get our needs met. I think those things are going to be more helpful, and both to your thinking and for the kids that you work with. So putting on your oxygen mask, first, thinking about resilience, and don't judge are kind of our big ideas so far. The next thing I want to talk about that's related is validation. And I found this picture that's up here that some of y'all can't see, of a little boy sitting by the lake, and he's got his arm around this giant teddy bear. And just looks like a really peaceful connection. And the idea of validation is to tell ourselves or kids or other people in our lives that we see them, we hear them, we care about them, and that what they're feeling is okay. Sometimes when we're frustrated with kids, we can send the message, you have nothing to be mad about. This doesn't really hurt. I don't know what your problem is. I love the old, I think Bill Cosby used to do a thing about like, I don't know why you're crying, but I'll give you something to cry about. And all of those things are really invalidating because it's telling kids that their feelings are wrong or that their feelings are not okay. And for kids to stay safe, we need to teach them to understand their feelings and to trust their feelings. So when we're invalidating kids and we're saying, I don't know why you're reacting that way, there's nothing to be upset about, or it's not a big deal, or it doesn't hurt, or it's not scary. When we say those things, we're actually making it harder for kids to be safe. So just validating their emotions. Now, a real important thing is that validating doesn't mean you agree. It doesn't mean that you are okay with the way that they're behaving, that you're okay with the choices they're making. You're just saying, hey, I see that you're mad. It's okay that you're mad. That's just how you feel. So some other ways that we can validate people and say, you know, I see what you're going through, is we can do this thing called normalize. We can make it seem normal. To say like, you know what, a lot of other kids feel mad. So like right now, you know what, I think a lot of kids are missing their friends. You know, I think a lot of kids are having trouble having to be home and not go to the pool. You know, I think a lot of people feel this way. We can also work at being really good listeners. And boy, this can be hard, but putting down your phone and making eye contact or sitting with a child who is upset. And sometimes you don't need to say anything. And in fact, the less we say, sometimes the better. But just to give them your full attention and to listen to what they have to say. Again, it doesn't mean that you agree. It doesn't mean that you're going to give in to demands that they're making, but you're really listening, really hearing what they're having to say. We can also use what's called reflection. And this is like the joke of if you see like a therapist on a TV show where they go, what I hear you saying is, that's reflection. And so you can say like, boy, I hear that you're mad. You know, I hear that you're really, really disappointed about that. I'm really getting the feeling that like this was a big loss for you. I'm hearing that this is really scary for you. And those are all things that validate emotions. We can also ask open-ended questions. So asking things like, you know, tell me more about what happened, or it sounds like you're scared. Tell me about what's scary about this. So inviting them to share more with us. We can also match their vulnerability. So we can be there with a kiddo, and we may say like, you know, I feel this way sometimes too, or I remember when I was your age, I was so disappointed. You know, and I will share a lot of stories with kids that I work with, and there are funny things that I remember, like telling my mom that she didn't love me because I couldn't have Twinkies, you know, or feeling so disappointed if my family didn't have money to buy things that I wanted, and how disappointing and hard and unfair that seems. So when we're willing to share that we feel some of those emotions too, that's a really powerful way to tell kids that they're okay and that we're listening. And a last thing that we can do is to ask them, how could I help you to feel better? So thinking about, you know, somebody's having a tantrum or somebody's yelling, and you know, you can say, wow, I see that you're really mad. You may do some things to help them calm down. And then when they're able to think about it, you know, say, what can I do to help with this mad feeling? Or what can I do to help with this problem? Sometimes they may know, sometimes they may not know. And then you can offer, you know, may I rub your shoulders for you? May I get you a cold glass of water? You know, may I help you with your math homework? May I help you take a break? And really kind of joining with them to help figure out what would make them feel better. one of the things I want to mention, and we all experience this even as grown-ups, is that sometimes when we're really upset, it's really like the thinking part of our brain is turned off. If we are very emotional, whether that is sadness, grief, anger, fear, it is very hard for us to really think through and problem solve things. And so sometimes we get in this situation where a kid is just in an emotion moment and we are talking and talking at them and we're ready to problem solve. I always think about, I don't know if you all have seen the Charlie Brown cartoons where the teacher always sounds like womp, 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 womp. I think we sound like that a lot to kids when we get to talking a lot at them. So I think it's important as you're thinking about these steps for validating emotions to check in with where a kid is at. And if they're still really, really upset, they may just need your help to cope. That you sit with them, that you help them breathe, that you help them go for a walk. And don't waste your breath or your time on the problem solving until they're ready. You know, we have to be calm. And you all can think about that in your own life where you're so worked up and upset about something, you're not going to have a logical conversation about it until you cool off a little bit. And the same is true for kiddos. That I want to share. And this again is changing our thinking about when we have challenging moments with the kids that we care for, rather than thinking about difficult behavior that we need to punish or we need to stop or we've got to work it out of them somehow. That difficult emotions and behaviors are really opportunities for growth. They're opportunities to connect with kids. They're opportunities to help kids learn. So I put this picture in here of an idea of emotion coaching. It's from the Gottmans, and they're two psychologists, a husband and wife, that do a lot of work on relationships, both kind of partnerships, marriages, and helping people with that, as well as helping parents with their kids. And I love them. If you've never looked up the Gottman Institute, they have great resources and great ideas. But they have this picture of a tree, of helping a kid to grow or to climb to the top of the tree, that starts with being aware of a child's emotions, then helping yourself to recognize that that emotion is an opportunity for connection and for teaching. Then step 3, helping kids label the emotion. Step 4, communicating empathy and understanding. And then at step 5, helping to set limits and to problem solve. And so I think, again, seeing this adventure that you're on of caregiving, that it's not your job to just stop or shut down behaviors or emotions, but you're on this journey of practicing and learning how we take care of ourselves. And you can be on that journey right side by side with the kids that you're caring for. You don't have to be perfect. You don't have to have all the answers up front to be a partner on that journey. So I tried to stick to big ideas, but that's still an awful lot of information in a short amount of time. So I'm going to turn off my slides, and we can open things up and see what questions people have, or if there are things people would like to share about your own experiences with those ideas.